Next, we will talk to Shelbourn Stevens, President of Novant Health Brunswick Medical Center. Welcome to the show, Shelbourn. It's such a pleasure to have you back.
It's great to be here, June. Thank you.
You're welcome. Now, for our viewers who didn't have the opportunity to meet you last time, tell us a little bit about your background and your education.
Sure. I got into healthcare years ago as a respiratory therapist, and after working in the clinical setting for a number of years, decided to go back to school and pursue a business degree. I did an undergraduate at High Point University, and then I did my MBA with Gardner-Webb University, and then came to Brunswick County in 2006 and been here ever since and love it.
Well, and we love it. We're glad to have you. There's been so many great changes at the hospital since you joined, and it's been a wonderful thing. So, now it's been a while since we have had you on the show, and I know there's lots of great things happening there. So tell us, what's new at Brunswick Medical Center?
Well, we've added a lot of new physicians. A lot of primary care physicians are moving into the area, which is greatly needed. We've added some new specialists, new urologists. We have some new technology that's going in. Most recently, people will notice that they have the iris scanning technology in their patient registration area. So that is a safe way of knowing that you're the right and correct patient, and they'll take your photo. So every time you come in, your picture will come up and all of your information will come up right away. So we're excited about all the new things going on.
Well, the other day I saw a little app for ER wait times. I saw a little card for that. Tell me about that.
With your smartphone or your iPhone, there's an app online that you can get information, like you said, around ER wait times, some of the clinic wait times, etc. With my chart that's out there, you can have access to your information with your physician or make your appointments online with your physician as well.
Wow, that's pretty cool.
It is nice. I use it myself every day.
Well, that's great. Well, today we wanted to specifically talk about the Novant Health Community Wellness Initiative that I'm hearing about. So first of all, how about explaining to us what the Community Wellness Initiative is?
Sure. Back in January, all across Novant Health, we declared a war, if you will, so to speak, around diabetes, hypertension, and obesity. They're very prevalent. They lead to more chronic illness, and we decided that it was time to declare a war on these initiatives and get out into the community and try to help keep our communities well.
Wow. And are those are three of the most prevalent conditions here in Brunswick County?
They are. Typically 1 in 3 individuals over the age of 20 have pre-diabetes. It's not quite diagnosed yet. 1 in 3 Americans have hypertension or high blood pressure, as most people know it as. And then 1/3 of Americans are considered in the obesity category.
So tell me, have there been any events in Brunswick County so far regarding this initiative?
Yes, we've had several. We had an initial kickoff with our employees at the hospital back in January. Also in January, we had one at the community college at the Fitness and Aquatics Center. Then with the Brunswick Beacon Health Expo in February, we held one there. And also C-Trail had an event of Ask the Doctor where we did a lot of screenings there.
That's a lot of screenings in 1 month.
We've been busy.
I think you have. Well, let's talk a little bit about the goals for the Community Wellness Initiative over the next year. I think you're doing it across the Novant footprint. Is that correct?
Absolutely correct. At all of our facilities, we're reaching out in all those communities to do these screenings.
How many people would Novant expect to screen?
We hope to screen at least 500,000 people in the inpatient setting.
That is a lot of people.
It's a lot of people, but that's in our inpatient setting and outpatient setting. And we hope to reach at least 25,000 with our screenings of the A1C testing and checking blood pressures and doing weights and heights for your BMI.
Well, have we done prediabetes testing in the past?
We have not, but we did start in the hospital a while back of screening patients, maybe having outpatient surgery, even our inpatients. Because like I said before, it's one of the few diagnoses that goes undiagnosed for quite a while until you start having lots of problems with it. So in the inpatient setting, we started screening patients with the A1C test.
So help me understand, Shelbourn, how the Community Wellness Initiative will be different from the patient testing that you just referred to in the inpatient population.
where we're actually going to be going out into the community to do these testing in all types of venues. We'll be working with our physician partners to identify venues to do this testing. So that's how we hope to target that large population number to do all of these screenings.
Well, that sounds great. And where in the community might these events be held? Give me some examples of where they might be held.
We'll do them really anywhere. We'll go to schools, into churches, we'll go into communities, large developments with the homeowners associating, any of their annual meetings or just gatherings that they have, anywhere that anybody wants us to come.
Wow. And that's all free?
Absolutely free.
Wow. That's a real bonus. Well, let's talk a little bit more about the screenings that will be done, the specific screenings, so that the population out there will know what to expect. So I know there are 3 screenings that we're doing, and one of them you mentioned the A1C. So let's talk about that a little bit.
The A1C test is what we use to detect pre-diabetes or diabetes. Typically in the past, when you go to have a test done or at a screening, they'll prick your finger and just do a blood glucose. That test is not quite so accurate. It's just a one-time snapshot of the test, and if you had a soda earlier in the morning or you ate something that morning, it's going to affect that. The A1C takes a broader look and a broader picture, so it can look back to 60 to 90 days around your blood sugar levels and really let us know a more accurate diagnosis of pre-diabetes or even diabetes.
Wow.
But at our health screenings, we have a lot of healthcare individuals who will look at your test results and be able to dialogue with you about these and help you with the next steps, get you in with a physician if we need to. If you do have pre-diabetes, we can get you into a clinic so they can get you education on proper diet. A lot of our events, we have nutritionists there and dietitians that can also give you a lot of education and valuable information.
Wow. And the other 2 tests that will be done that day are blood pressure?
Yes, blood pressure checks, and also then we'll do your height and weight, which will give us what we call the BMI, your body mass index, which is a target number to let you know if you're in that obesity category or not, or if you're getting right on the edge of that obesity category.
So when you're there having the test done, you're probably in sort of an enclosed area, and then you have the opportunity to dialogue with your healthcare support person there.
Yes.
And can discuss the results and what have you.
Yes. I mean, we have a variety of resources from nurses to other clinicians. Some physicians do attend these, dietitians. So really it just depends on what we find wrong or even what questions you have. We can connect you to those right resources.
And if a person has the screenings done and they really don't have a primary care provider or in the area, might you be able to provide some of that information to them?
Absolutely. We have a list of all of our providers in the area, and we can get you phone numbers and help you get connected with any provider here in Brunswick County to get you in with a primary care physician or any other provider.
And speaking of that number and how to contact them, where might the folks in the audience, where might they go to find that information?
The phone number that they can call locally is 910-721-1473, or they can go to the website at novanthealth.org/wellness.
Okay. Well, that sounds great. I'm just so shocked that all that information and those services are available and it's free of charge.
It's all free of charge, and it just goes back to our promise that we rolled out last spring, that we're here for you when you're sick, but we also want to be your healthcare partner to keep you healthy and well. And
it sounds like it's going to be convenient because we're going to come to you.
And that's part of our promise too. We're bringing all this local and making it easy for you.
Wow. Well, thank you so much for being here today. You always bring us really great information and all this new stuff, and I can't wait to see what you have to tell us next time. So you'll come back, right?
I'll definitely be back.
Great. Well, thanks again for being here, Shelbourn.
Thank you, Jean.
You're welcome.